Hello, and welcome to the summary for Week 3 of the Management of Lower Extremity Disorders, Section 5. My name is Bill Owen. I apologize for the quality of the audio of this presentation. And here are some of the things we'll be reviewing in this week's summary. We're going to go over some of the learning materials of hip disorders and regional interdependence. We're going to go over some of the feedback for the course as well as future topics. We're going to look at the quality of posts and further expectations. We'll also provide a review of next week's assignment and, of course, the shoutouts of the week. This week's learning materials discussed how the differential diagnosis of hip disorders can be challenging because these symptoms can come from areas that may refer into the hip as well as pathologies that may affect the hip locally. This can be confusing, whether you're using evidence-based practice techniques or the impairment-based approach, which is also based on evidence. There are a lot of articles that talk about the validity and reliability of tests, and this can help us decide, using evidence-based practice, which type of treatments we would be using for the patient. It just depends upon what you have in mind. The impairment-based approach chooses treatment plans that are based upon how the patient responds to our examinations and subsequent visits. We use clinical characteristics that will guide our clinical decision-making, factors such as the patient's age, the mechanism and acuity of the injury, and the patient's response during the physical examination and subsequent visits, as I mentioned before. This week's material also talked about regional interdependence, which is used when determining whether or not the source of pain is musculoskeletal or non-musculoskeletal. This week's lessons discuss in relationship the knee as a potential source of pain, as well as mechanical problems coming from the opposite lower extremity affecting the patient's chief complaint. The evidence of regional interdependence can also be seen in case studies where patients who presented with the primary complaint of low back pain also presented with hip and knee pain, and also vice versa. The regional interdependence model focuses on impairments along the proximal and or distal segments that doesn't emanate from the hip. Remember to go up and down the chain, looking at lack of mobility or muscle weakness, which can in turn place a lot of stress on the patient's area of chief complaint. Now for some feedback, please feel free to email us if you have any questions about what you're doing or how you're doing. You should be receiving feedback from us, but we certainly appreciate feedback from you as well. Let us know what you liked so far about the course, and let us know what you would like to see improved or changed in future courses. Let us know if things are getting easier, but especially let us know if you're having any struggles with the week's materials. Also let us know if you're not receiving email notifications about activity in your discussion areas, as many of us tend to rely on emails to let us know if someone has responded to our post instead of checking the website itself. And always feel free to contact us if you have any questions regarding the week's topic or assignment. If you have a question, more than likely somebody else is struggling with the same thing. Overall, the quality of posts this week have improved as a lot of you are doing a great job demonstrating a good understanding of the week's materials. You're also including your clinical experiences in regards to the week's topic and sharing how the week's learning materials will or will not have an impact on your practice. Remember to go beyond the assigned reading and presentations, adding outside references to your post, and please provide a complete bibliography of the clinical evidence you cite in case there's an article someone wants to read in detail. Remember that you can't provide a good critical review of an article by just reading the abstract or the summary of the article on the internet. Please be consistent with uploading these articles into Dropbox because by now you should be creating quite an extensive collection of articles that can be used not only to help you with your recall, but the articles can also be used for future posts or when you want to discuss the information with your colleagues. Let us know if you're having any barriers finding outside articles or if you're having difficulty organizing the vast amount of learning materials in your collection. We have a lot of experience searching for clinical evidence and trying to keep it organized. Remember that it's extremely important to interact with your classmates, and remember that you're not limited to interacting with just one other person. There are a lot of good discussions going on in your group and in other groups as well. Remember that the deadlines for original posts are due Wednesday by midnight, and please try to reply as early and as often as possible to others in your group instead of waiting for the last minute when it's too late when a good conversation just gets going. It's really awesome to see a great debate going on between multiple classmates and instructors as well. Keep in mind that this is didactic education, so we learn by posting our thoughts and provide our responses to other people's thoughts, stimulating our conversation by sharing our experiences, whether they're good or bad, so we can become better therapists for our patients, which is why we took this course in the first place. Remember that the cutoff for replies is Saturday at noon, so that will give us time to complete grading your posts and responses. And please give us any type of heads up, whether in your post or by email, if you'll be unavailable to post your original thoughts on time or provide subsequent responses, as we will soon be going into our weekend intensives, which will limit our availability. To sum it up, we would like to see more in-depth posts and analysis, including critical review of the articles. We would also like to see more interaction with more than just one other classmate in your group or classmates or other groups. We'd also like for you to cite more clinical evidence outside of the materials already provided to you in this course. And we would like to see more discussion of the clinical implications of the week's materials. And also ask more thought-provoking questions which provide better interaction and learning in this course. Remember that you get out of this course what you put into it. Take advantage of your instructors and each other's clinical experience and education. Also, this is a reminder to myself as well as the other fellows in training out there that both content and TA roles should be responding to our first case-based discussion we recently posted. Just like our weekly posts, we should be looking at how the recent assignment applies to our current clinical practices and how we plan to improve from this point going forward. And in going forward, please remember that we are reaching midterm and we will be working hard to finalize your midterm reports and give you the individualized feedback you deserve so you know how you're doing individually and what you can do to improve as we go into the second half. At the end of week 4, we will be swapping some groups and you'll be able to have new classmates, so keep that in mind going into this last half. Remember too that you will be involved in a group project that will be in addition to your weekly projects. And lastly, the shout-outs. Scott Akers, he did a great job synthesizing the week's materials into his post as he came across with a critical mind and did a good job citing outside articles to support his statements. Catherine Tutko did a very good job providing quality posts this week with some great points brought into the discussion. Melissa Johnson had a good discussion in this week's articles with nice reflections on comparing her patient population with those in the study. And John Philip Montez had a good discussion on various articles this week with nice use of additional references. He also had a great discussion on treatment and breakdown of the treatment phases. And kudos to everyone this week and keep up the good work.